nurse practitioner today. What brings you in?
I'm having some right elbow pain.
Okay. Don't mind me. I'm gonna wash my hands here. Put on some gloves. How long has that been bothering you?
About a week.
And is it constant? Does it come and go?
It just usually happens when I lift things up.
Okay. And what would you describe the pain as? Like sharp or dull or ache?
Yeah, like a sharp pain.
Okay. And it's worse when you're lifting?
Yes.
Is there anything that makes it better?
When I'm sleeping.
Okay. Have you tried any medications or anything?
No.
To help? Okay. Is it radiating anywhere, like down your arm or up into your shoulder?
Nope.
And is you said it's better when you're sleeping, so it's not like different throughout the day?
Nope.
And what would you rate the pain as 0 to 10?
A 4.
Okay. I'm gonna review your medical history now.
Okay.
Do you have any prior history of any hospitalizations?
No.
Any surgeries?
No.
Any past issue with an illness similar to this?
No.
Any chronic medical conditions that you're currently being treated for?
No.
Do you or your family have any history of cancer?
No.
Asthma?
No.
Alcoholism?
No.
Heart disease or hypertension?
No.
Diabetes?
No.
And are you currently or have you been treated in the past for any mental illness?
No.
Okay. Gonna review some of your sexual history now. Are you currently sexually active?
No.
In the past, have you been sexually active with men or women?
Men.
And did you use protection?
Yes.
What were you using?
Just like condoms.
Okay. Were you, or have you had any history of any sexually transmitted infections?
No.
Are you, having normal periods?
Yes.
And when was your most recent period?
3 weeks ago.
And your cycles are normal?
Yes.
Or, like 28 to 30
Yep.
days? Any work outside the home?
Yes, I'm a nurse.
Okay, and how many hours a week do you work?
36.
And do you live in a home?
Yes.
And who do you live with?
Me and my son.
Okay, and how many pregnancies have you had?
1.
Okay. Do you have enough food in the home?
Yes.
And are you coping well with your stress?
Yes.
What is your diet like? Are you getting enough fruits and vegetables?
Yes.
And do you exercise regularly?
Yeah, about 3 times a week.
Okay, like
an hour.
Cardio or?
Yeah, like an hour each in like running or yoga.
Okay, great. And do you feel like you're well rested
Yes.
after you sleep?
Yes.
About how many hours of sleep a night do you get?
About 7.
And do you use any alcohol currently?
No.
Do you have a history or are you currently smoking?
No.
Ever vaped?
No.
Or chewed tobacco?
Nope.
Any illicit substance abuse at all?
No.
Okay. Or substance use? Do you currently use any?
No.
Okay. Now I'm going to kind of go over some more current information. Do you currently take any medications that are prescribed?
Nope.
Anything over the counter?
Nope.
Any supplements or vitamins?
Just a probiotic.
Okay. Is it
Just daily.
once daily?
Yeah.
Okay. And sorry, trying to remember.
Okay.
Oh, do you have any allergies to medications?
No.
Any allergies to anything in the environment or food?
No.
Okay, good. you, that's behind the wall.
That's downstairs.
Okay. Alright, I think I reviewed everything. I'm gonna go over your, like, health, like, your normal, like, body systems now, and
Okay.
ask you some questions.
Okay.
Do you have any, like, feeling of fatigue, or have you had any fevers?
Nope.
Do you have any eye pain or eye drainage?
No.
Do you wear glasses?
Yes.
Okay. Do you have contacts in, or?
Yes.
Okay. Any nasal drainage or congestion?
No.
Any ear pain or ear drainage?
Mm-mm.
Any difficulty swallowing or speaking?
No.
Any pain or swelling in your neck?
No.
Any pain or swelling in your breasts?
No.
Any shortness of breath or cough?
No.
Any headache or dizziness?
No.
Do you feel like you're having any irregular heartbeats or any chest pain?
No.
Any nausea, vomiting, or diarrhea?
No.
Do you feel like you're peeing okay?
Yes.
Any burning or abnormal color to your urine?
No.
Are you having any increase or decrease in your weight that's an abnormal, like, fluctuation? Besides the right elbow, are you having any joint pain or swelling?
Nope.
Any excess bleeding, like when you cut yourself, or any easy bruising?
Nope.
Any increase in sweating or thirst?
Mm-mm.
Any swelling that you've noticed in, like, your legs? Any, Oh, and are you currently, or have you had any, signs or symptoms of, like, anxiety or depression?
No.
Okay. So I'm gonna go ahead with, doing your assessment now. I'm gonna start with some neurological, questions and techniques.
Okay.
So, if you could, I'm gonna have you pull your mask down. If you can close your eyes and close one nostril, I'm gonna have you smell something and tell me what you smell. Okay, go ahead.
Chocolate.
Okay, and then I'm gonna do the other side.
Yeah.
Okay. Any trouble breathing through either nostril?
No.
Okay. Then I'm gonna have you, I'm gonna use my light here. If you can open your mouth and say ah. I'm gonna look, that your tongue is midline, your uvula raises with phonation, I hear good tone with your voice, and your soft palate looks intact. Then I'm gonna have you stick your tongue out for me, and from side to side. Great, I'm gonna have you push on with your tongue in your cheek, and I'm just gonna check for the strength. Good. I'm gonna have you shrug your shoulders for me. Great, and then if you could tip your head side to side. Okay, great. Any pain or discomfort doing any of those things?
No.
All right. Then I'm gonna have you touch your finger to your nose, and then you're gonna bring it out to my finger and go back and forth. And then with your other finger, same thing, out and back. Okay, great. And then I'm gonna have you do your heel down the front of your shin. And then if you could do both sides, yep. Good, and other, great. Great, okay, so that looked even, symmetrical, looked like your muscles were symmetrical and able to perform that. Then if you can, I'm gonna check some musculoskeletal things now. So I'm gonna have you bring your arms out and kind of up above your head, and then come down. Then I'm gonna have you bring your shoulders like out, flex down and up. Then I'm gonna have you reach behind and touch your shoulder blade, and then do the other side. Okay. And then if you can bring your palms down, and then like you're flexing, good. And then flip back and forth, and then rotate your wrists. And then we're gonna check your like fingers, so finger to thumb, good. And then if you can bring your thumb to the fifth finger, okay. And then if you can make a circle with your thumb and forefinger, okay. Just checking the strength here. Push out with your fingers and bring them back in, good. And then same thing if you can like bring your arms, push up. Okay, and then I'm gonna push down, keep them up. Okay, and then if you hold them in, I'm gonna push out, and then hold them steady. I'm gonna try to push in. Good. I'm gonna have you walk towards me, just normal. Great. I'm looking at your gait. Everything looks steady, and then face away. And if you could do heel to toe for me. Good. And then turn back around. I'm going to have you walk a few steps on your heels and then switch to your tippy toes. Good. Any difficulty doing any of those movements? Okay, great. That looks good. Then I'm going to just check and palpate like your joints. This one might be have a little swelling with the pain. I don't feel any other swelling or bagginess in the joints. If you can turn away from me, I'm going to check your spine. So I'm going to inspect for any abnormal curvatures or bulges. Everything looks symmetrical. Shoulders look symmetrical. I'm going to palpate, and then I'm going to have you go ahead and bend forward, and I'm going to check the curvature of the spine, and everything looks and feels symmetrical. And then if you can flex like down to your side and to the other side, and then back a little bit. So she's got good range of motion with her spine. Okay, you can turn back towards me. And then if you can sit, I'm gonna do a check for like your sense of touch. So I'm gonna have you touch this. This is the sharp sensation, and then this is the dull. And just tell me, with your eyes closed, what you're feeling.
Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp.
Okay. Then I'm gonna check reflexes. Gonna do your shoulder. And then wrist. And then elbow. And then I'm gonna check knee and ankle. Okay. And then while I'm doing all this, she looks generally well kept and healthy. Hair and scalp look clean with good hair pattern. Facial symmetry, alert and oriented ×3, calm and cooperative, answers questions appropriately. I looked at skin. I would have her in a gown if I was doing this in an office so that I could visualize all of her skin for pigment, rashes, lesions, or abnormalities. And then I would have her lie down to do the meningeal test. So for Brzezinski's, I would have her lay supine, bring her neck forward, and check for the knee or the hip to come with the flexion. And then I would passively range of motion her leg up and down, checking for resistance or pain, and then flexing her foot while I raise the leg up, checking for pain or resistance for Kernig's sign. And if I felt there was something else that I needed to check for your elbow, I would consult or order appropriately. I think I'm done. Oh, okay. I forgot a step. I need to do one more or two more of the ataraxis test. So like you're stopping traffic, and then if you can push against the wall for me, I'm gonna look for the scapular winging to make sure that's symmetrical. Okay.
Far one from my legs.
Okay, and then, okay, so if you can, bring your leg up for me, and then out, and then back in, and then do the same with the other side, up, out, back in, and then with the knee, bring it up if you can extend, and do it on the other side, extend and bend. Oh, and if you can hop in place for me, I forgot to do that one too. And ankle flex and extend, and then rotate. Yep, and on the other side, flex, extend, and rotate. I think I'm done.